This video is brought to you by the South Tees Hospital's NHS Trust to give you information about dysarthria. It may be that a friend or relative has recently received this diagnosis, or that you work with people who have this diagnosis and you want to know, what does this mean for that person and what can I do to help? So what is dysarthria? Dysarthria is a communication difficulty caused by the muscles used for speech being weak or poorly controlled. There are a number of things that can cause dysarthria. For example, brain injury, neurological diseases such as Parkinson's, multiple sclerosis, and motor neuron disease, stroke, brain tumours, infections, and facial paralysis. People with dysarthria have difficulty forming and pronouncing words because the muscles needed for speech have reduced movement and/or coordination. The breathing mechanism for speech can also be affected, meaning that people are unable to coordinate their breathing with their speech, and can sometimes end up running out of breath while speaking. How can dysarthria impact an individual? Dysarthria can have a huge impact on a person's life, both socially and emotionally. Because dysarthria impacts speech intelligibility, a person's social relationships, educational and employment opportunities, participation in hobbies, and ability to communicate their needs can all be affected. Having dysarthria and not being understood by others can be extremely frustrating and can often have an isolating effect. By getting a better awareness of what dysarthria is and what you can do to aid a person with dysarthria's communication, you're already taking the first necessary steps to improving the quality of life for someone with dysarthria. What are common presentations in dysarthria? Some difficulties may include reduced facial expression due to a person's muscle weakness, reduced clarity of speech. For example, the individual's speech may sound slurred. This is often due to the person being unable to move or coordinate important body parts needed for speech, such as the tongue, lips, and jaw, and therefore the person is unable to produce the speech sounds correctly. Reduced range of pitch, so the individual's speech may sound monotonous. This can make it very difficult to read someone's emotion from their voice. Changes to their voice quality. Some people may sound breathy, others may sound hoarse. Some people's voices can sound strained, and sometimes people can have a nasal quality to their voice. Changes to the volume of their voice. So some people may have an overly loud or quiet voice and find it difficult to alter the volume. However, people with dysarthria are often not aware that their volume has been altered. For example, if someone's speech is overly quiet, they often believe that it is their communication partner's hearing which is affected, rather than the volume of their speech. Changes to the rate of their speech, so people can have an overly quick or slow rate of speech. Difficulty controlling breathing during speech, so people may run out of breath while speaking. Tremors in speech are also common in people with dysarthria. How common is dysarthria? The Stroke Association reported that there are 250,000 people in the UK living with dysarthria following a stroke. There are between 100 and 150 people per 100,000 in the UK with dysarthria following an acquired brain injury, such as a fall, road traffic accident or brain tumour. And 10 million people in the UK with progressive neurological diseases have dysarthria. Research has found that close to 90% of people with Parkinson's disease experience dysarthria. What is the role of a speech and language therapist in dysarthria? Speech and language therapists start by assessing a person's speech difficulties and seeing what their articulation of speech sounds and words is like. They will also assess the movement of the person's face, lips, and tongue to determine where the muscle weaknesses may be. From these assessments, a speech and language therapist can then talk with the person about what areas of their speech they may want to improve and what will be most helpful to work on in order for them to cope better in day-to-day life. From this conversation, therapists create realistic and achievable goals for the client and provide them with exercises and strategies to improve speech clarity, as well as teaching compensatory strategies for when they may struggle to produce intelligible speech. If the dysarthria is severe, speech and language therapists can also advise on the use of alternative and augmentative communication, or AAC. What is AAC? AAC includes a range of alternative methods that an individual can use to communicate. Some examples include communication books, which give word and picture options that clients can point to during conversation, alphabet charts, which help clients to spell out words, and iPad applications, which provide possible common word options the client can select, or a keyboard for clients to type words or sentences on, which can then be played aloud. As well as working one-to-one with the client to help improve their dysarthria, speech and language therapists also offer support and education to those involved in the person's life, such as friends, relatives, carers, and members of the multidisciplinary teams in hospitals. Speech and language therapists help to train these communication partners to ensure that they are able to socially engage with the person who has dysarthria and help them to practice what they have learnt in their therapy sessions. So what can we do to help people with dysarthria to communicate? Avoid unnecessary background noise and interruptions. Providing a quiet communication environment to a person with dysarthria enables them to concentrate better on forming the speech sounds correctly, which subsequently leads to more intelligible speech. Allow sufficient time for the person to get their message across. If the person feels hurried, their speech difficulties are likely to get worse, so don't rush to make assumptions about what the person is trying to say. Allow them time to say it. Position yourself so you can watch the person with dysarthria as they speak. By doing this, you may be able to pick up clues about the words attempted from the person's mouth shapes. If you don't understand a word that has been said, you could ask for repetition of the word through a closed question, or repeat back to them what you have understood so the person with dysarthria can then confirm either that you have understood them or correct any misunderstandings. You could also ask them to spell the word or write it down if they are able. To increase the clarity of the person with dysarthria's speech, you could encourage them to slow down the pace of their speech. This gives them time to form the words as clearly as possible. You could encourage the person to over-articulate each speech sound in the word, and encourage the person to split long words up into syllables. You could also prompt the person to use key words or shorter sentences, and encourage the person to use natural aids for communication, such as gestures, pointing, and writing words down. If the person has been provided with AAC, you should encourage them to use this too. If the person has trouble coordinating their breathing for speech and appears to be running out of breath, encourage them to pause and take a breath before continuing. Encourage good posture. You can do this by ensuring that there is adequate support for the person's back, neck, and head, promoting an upright position, as a poor posture can inhibit breathing, which is necessary for good speech. Additionally, if the person wears glasses, hearing aids, and/or dentures, make sure that they have them whilst they are communicating with you. If the person wears dentures, make sure they fit well, as sometimes they can move due to the altered muscle tone, and this can impact the clarity of their speech. The stress and negative emotions that a diagnosis of dysarthria can bring is likely to not only impact the person, but also their family, friends, and carers. Introducing these simple communication tips into your conversations is the first of many small steps to help people with dysarthria regain their confidence, participate socially, and regain their identity. There are lots of other places which can give additional information as well as support for helping and caring for individuals with dysarthria. These include local support groups for families, friends, and carers, communication partner training with a speech and language therapist, speaking with a speech and language therapist, as well as online training for healthcare professionals, and impairment websites. Some useful websites include Headway, Stroke Association, the Royal College of Speech and Language Therapy, Communication Matters, and Find a Voice. Thank you for watching this video. We hope it was useful and informative.